Children make up a small portion of the COVID-19 cases. While they're less likely to become severely ill than adults, we've had 3 children die here in this country because of the virus. So we want to talk a little bit more about that. We're bringing in pediatrician Dr. Dyan Hes to talk about this because, doctor, as we've learned more and more about this virus, initially we were told, well, only people sort of over 80 really had to be very concerned. And slowly that number started to drop. And now, we've seen children become particularly sick with this virus. Most do not die, but they can get very sick. So last week, the CDC released a preliminary report about the first wave of the coronavirus here. What did we learn from those numbers?
Well, I don't mean to be rude, but the numbers are totally wrong. So I think that probably 80% of the children have coronavirus. We are not testing children. I'm in New York City. I can't get my patients tested. And we have to assume if they are sick, they have coronavirus. Most of them, probably 80 to 90% of them, are asymptomatic. So these numbers are so skewed. I think that the mortality rate is way, way less than probably less than 0.5% for children who have it, because it is so prevalent. We have 0 tests for children. We have 0 swabs. If I have a patient whose parent has, and I can tell you, I've had patients whose parents have COVID, child has 102.5 fever. At the beginning, when we were doing this, we were sending them to the ER. They got turned away. They were not tested because we do not have enough tests, and the kids are doing well. You have to remember, thousands of kids die from flu a year. This is much, much less virulent in children. The problem with children is that they are so asymptomatic that they are spreading it. And our biggest mistake was that we didn't close the public schools when we should have. Schools were kept open. So the children were the vectors to the teachers who might be elderly or immunocompromised. They might have diabetes or cancer, but they still had to come to work every day. They still had to take the subway every day. So I have to tell you, I'm doing telemedicine 3 days a week or 4 days a week, and I see patients the other 3 days a week. I've had 2 patients in the last month with a fever. Social distancing works. Children are not in contact, and they might be shedding it, but they are not getting sick.
So, doctor, what should parents be looking for in children and in teens, especially if they're asymptomatic? I mean, and we're not testing them. How would a parent even know?
So you won't know. The thing is, if your child does have a low-grade fever right now and a cold, you have to assume that it's COVID, because you're really not going to get tested in New York City. In other states, maybe you'll get tested, but in most places, we're saving the test for the sickest. Okay, so if you're socially distanced and your child has a fever, then somehow that child probably brought it into the house by playing with a neighbor, or maybe when you went grocery shopping, you brought it in. But you just have to keep that child at home for 14 days, socially distanced. When they go back out, if they're above age 2, they should be wearing masks. The really only reason your child should be going to a physician at this point, aside for a vaccine visit, is if they're short of breath.
That is solid advice. You brought up the whole vaccine visit because one thing that amongst the many impacts of this coronavirus is that sort of the routine health care has been suspended in many ways. And in a number of places, they've completely suspended at least vaccinations for now. Can we talk about that, though? Talk about
Sure.
sort of moving forward, the long-term impact. Sometimes when people get thrown off of that schedule, they don't get back on it.
Exactly. So the American Academy of Pediatrics recommends that all children under age 2 still stay on their vaccine schedule. So what we're trying to do as pediatricians is we're trying to do a lot of that visit at home via telemedicine, like all the developmental, the milestones, how the child is eating. Now, we have the luxury of telemedicine in America. Look in the other countries, third world countries, where they don't have masks for their patients to come out of their home. And they are really going to fall behind on their vaccines if they're being told to stay at home, because they're not going to be caught up with their polio vaccine or their DTaP vaccine. And then we're going to just see other outbreaks. I mean, it's such a conundrum. We have, what we do is we ask one parent to come to the office. We ask them to wear a mask. If they don't have a mask, we'll provide them with a mask. Most babies don't tolerate masks. So we are all protected. We all wear, our gear to not shed it if we are to them. We have the children come in. We have one patient coming in at a time, and then we send them out the door. And we do the rest of the visit on the phone or telemedicine. I am terrified of the outbreaks that are going to happen now in other countries maybe the US. I hope not, because I really think that most people are still being encouraged to vaccinate their children, and we try our best. Our biggest problem, I would say, is that in New York City, I would say 80% of my patients have left New York City. So they have to find a new pediatrician wherever they are. And that's also hard, because during this crisis, a lot of doctors don't want to take on new patients because they're overloaded with dealing with their own financial crisis, dealing with their staff, dealing with furloughs. So what we're doing is we're emailing patients' vaccine records to their different states. We're trying to, network even on Facebook. Oh, do you have a practice in Virginia? I have a patient who's living there with their grandparents. Can they come to get vaccines? So we're doing our best to try to keep our patients vaccinated.
It's such a good point that you bring up, doctor, and I know we're talking about children, but the point that you just made about doctors being overloaded, being unable to take on new patients, and the fact that a lot of New Yorkers, those who can afford to leave the city, have done so. I have a very unusual situation, and my general practitioner passed away a couple of months ago, and I've been without a GP for the last couple of months, and I'm fortunate that we have medical doctors on our staff here at CBS, but I'm sort of in that space where I don't have a doctor, and I wonder for people who are in that situation what they can do other than telemedicine.
And urgent, that's why urgent cares have been overloaded. The other thing is sometimes you have a state-dependent insurance. So let's say you wanted to leave New York City and you went to Connecticut, you might not be able to go because your insurance won't work there. And, we have tons of kids in New York City who can't leave. I mean, my family's in New York City. I can't leave. I'm an essential worker. And my kids are lucky that they have us, me. I don't have to leave the house if they're not feeling well. But it's every day it's a choice, a difficult choice, parents. And I understand their fear. We have newborns being born every day in New York City, and the pediatricians have to keep their offices open to see them. And because they're being discharged so quickly to get them out of the hospital, we have to see the patients within 24 to 48 hours. And parents are terrified to come to our office, so we have to reassure them. We scrub, we clean, we wipe the door handles. You won't be with any other patients. And as a parent, I understand that fear, but I do have to say that coronavirus really has not been dangerous for the non-immunocompromised children. Children with cancer, of course, it's terrible. Sickle cell disease, any kind of immunosuppression, those children are at high risk. And I think the general population is now understanding why we push vaccinations all the time. This is how people who are immunocompromised feel all the time when the population is not vaccinated. This is what they go through every day about going out of the house with their kids.
So, doctor, I got to ask you about something else. I read a headline the other day, and I had to read it twice because I was dumbfounded. It essentially said that adults are now buying breast milk because some believe that it can protect them from COVID-19. There's this conversation out there now, and I believe there are studies looking into it, that breast milk may contain antibodies that may have some sort of protective abilities. Can you speak to that?
There's no proof of that yet. This is all hypothetical. So right now, we have the biggest problem is mothers who are positive wanting to breastfeed their babies. So we're encouraging them to wear a mask and gloves every time they pick up their baby, or if they pump, to do it under we can't say sterile conditions, but as clean as possible, that if they're pumping, they should wear gloves, put it in a bottle, have somebody else feed the baby. There is no proof that breast milk at all can cure COVID or give you antibodies. There's no data that I know of that has been published yet about it.
Okay, wait, can I just ask, as
Sure.
perhaps one of our viewers who does not have children, and so Anne-Marie, what you said is the headline said that adults are buying breast milk. Where do you buy breast milk? I've never heard of that. Maybe it's common. What am I missing here?
Yes.
What?
You can buy it on Facebook groups, parents. There are donor banks. An adult is not going to get a donor bank breast milk, but there are people who will sell anything. And I have to tell you, not related to COVID, I've had patients before who felt very desperate because they could not produce breast milk, and they bought what they thought was breast milk online. And then I've had very severe anemic babies because maybe it is breast milk, but they're diluting it, or it's not been tested for diseases. So I would not recommend that. That would be the lowest thing on my list. I think you could take some vitamin C and zinc if you want to, but do not buy breast milk to prevent COVID. That is not going to help you. No.
That's good information. I was curious because I had never heard of that. I'm guessing for some moms who are unable to produce their own, it's probably useful, but I just had never heard of that. So I'm glad I learned something new today, as I think so did our audience. Thank you, doctor.
You're welcome.